RNMD is a show about hospital relationships from the perspective of doctors and nurses. You're very smart, and we know that you would never come to a podcast for medical advice. So obviously, call your non-podcasting doctor and nurse team if you need any medical care. Oh, and we should also mention that we don't represent any hospital at all. Ever. Okay, start the thing. Hello, everybody, and welcome to another episode of RNMD, a show about doctors and nurses working together in this mad world of medicine. I'm Abby, I'm your nurse host, and today Daniel couldn't join us. Daniel is working 1,000,000 hours a week right now, and he's really in the trenches, and he has to focus on his job, being a doctor and his patients. So we're going to give him a pass. He cannot join us today, today we're very lucky that we do have a special guest, William Amarquaye. He is a pharmacist in South Florida, and I think, as everyone is aware of right now, South Florida is being hit particularly hard with COVID. And so we had just a really nice chat about Florida and their response to COVID and being in the pharmacy and what that looks like, being a frontline worker, and kind of what pharmacy is experiencing, because I feel like sometimes there are certain jobs that get left out from the frontline worker talk, and I feel like pharmacy is one of them, and they do such a great job, and I'm really proud of them, and at least the pharmacists and all the pharmacy staff that I've worked with have been phenomenal, so I just felt like we really need to give them a shout out. We also discuss more personal issues with William regarding sickle cell patients and the treatment and the racial bias that sickle cell patients experience. And this conversation was really informative, and just William is such a lovely person to talk to, and I wish him the best, and I hope everybody in Florida is doing okay. Reach out to us if you're in one of these areas, Florida, Texas, Arizona, any of these areas that are getting hit hard. If you need anything, please reach out to us, because we want to do whatever we can to support you guys. Everyone really stepped up for us, and we want to do the same. Okay, enough of my rambling. So let's go to the interview with William Amarquaye, pharmacist from South Florida, frontline worker. Here we go. How's everything? How are you?
Doing pretty good. With everything going on. I think just trying to take it day by day.
Oh my God, you guys are going through it just like we did.
Yeah, what state are you in?
I'm in New York City.
Oh, you're in New York City. Okay. Oh, wow. So you were at the epicenter a while ago, yeah. Yeah. And we thought, okay, if we go through this and we kind of squash it, and then the rest of the country will be okay. And now it's just like, right. What did we do that for? Yeah. I bet you guys are looking at us and like, oh man, it's crazy.
I mean, I feel bad for you guys. I feel really bad for you. I mean, we've been there. It's really hard.
Yeah. And I think you guys recorded you had 0 deaths, I think, the other day from what I saw, which was for the first time. Yeah.
Yeah. Since March, I think, actually.
That's awesome.
Unbelievable.
Yeah.
Okay. So let's get started. So, okay. First of all, one thing about me, I love to do research. So before I knew I was going to talk to you, and Florida is going crazy right now.
Yeah.
So I looked up a few things. So like you mentioned, New York City, we just reported the first day of non-COVID deaths since March. And on the flip side now, the Florida Health Department reported 15,000 new COVID cases, the highest number in a single day in the U.S. since the pandemic began.
Right. Yeah, those are those are some crazy numbers that we're dealing with here. So I remember I that and I was like, wow.
I mean, how are you doing? Are you okay?
Yeah, I think for the most part, I'm doing good. It's been pretty crazy this time because when this whole pandemic started, I think we were having some patients here and there, and Florida wasn't really being talked about too much. But then now it's just everything on the news is about Florida, Disney World, and everything Florida. So I think now it's kind of getting a little bit more stressful because resources are being strained, and our hospital is trying to figure out ways to really combat this thing. So I think it's getting a little more stressful, but I'm just trying to take it day by day, and that's all I can do. So that's, but yeah, it is getting stressful.
Yeah, definitely. You're feeling that directly at your hospital? You're feeling the impact of the COVID cases?
Yeah, at first we were having cases here and there, but the CEO of our hospital, he sends out emails and gives us debriefings about how we're doing, and we're seeing high numbers of cases at our hospital, and it's very interesting because the cases that we're seeing and in our ER we're running out of beds too. I think we've already run out of beds, but I think our hospital and some other hospitals are on bypass, so that means that we're not taking anyone in. I think they've stopped elective surgeries as well, and they're taking only medical emergencies. So at one point we stopped, and then things were getting a little bit better, and then we opened it up again. But now with the whole surge, we've stopped elective surgeries again, and only taking true medical emergencies. So it's been pretty interesting. Wow. Yeah.
So if your hospital's bypassed, is there a place for patients to go?
Yeah, we have other hospitals in our area that they can go to, but from what I'm hearing from the other nurses and the physicians there is that a bunch of other hospitals are on bypass too. So I'm not really sure what's happening. So it's,
what do they do?
Right.
Yeah,
exactly. So it's
my gosh, that's crazy. I mean, I know when it happened to us, I mean, frankly, I never didn't believe in COVID. I never was like one of these people, but I remember thinking kind of along the lines of like, well, we deal with infection control every single day. And we have a lot of patients that have even tuberculosis or, sometimes measles. I mean, things that are really contagious.
Yeah.
And so for me, I was concerned, especially when it hit Italy. I was very concerned, but I thought we can handle this. We've got it, But the thing I quickly realized that I overlooked when it came here was these patients are ICU level patients, a lot of them.
Yeah.
And they just take a lot of space and a lot of equipment and a lot of medication and a lot of resources. And they just drain, everything that your hospital has. So it just takes over the whole system very quickly.
Right. When I first heard about the pandemic, I wasn't really thinking about it. I was like, okay, that's fine. I heard about it in other countries, and I'm like, okay, it's not going to really come here and affect us. But then I'm hearing about these cases. I'm hearing about people coming back, from other countries, coming back to the United States, and then, cases popping up here. I was like, oh, maybe this is something I should,
start reading about.
Yeah.
Yeah. Some of that now, in hindsight, I'm looking like we weren't nearly concerned enough.
Right.
I mean, now I'm just like, oh my God, how crazy.
Yeah.
Okay. I just want to go over really quickly. So as of right today that we're recording is July 13th. We have 33 states are seeing an increased rate of new COVID cases versus last week. And obviously Florida, we already went over the statistics, and it's really scary.
Yeah.
You guys went into phase 1 May 11th.
Yeah.
And then phase 2 June 5th.
Right.
And you had about 1,300 cases at that time. And then about 2 weeks later, June 27th, you guys had like 9,500 cases.
Yeah, it's insane. I mean, when I first heard about the 3-phase plan that the governor rolled out, I thought it was, it was a pretty good plan. It was, methodical. But I think he went through them too fast, because at one point I didn't even realize we were in phase 2. I thought we were still in phase 1. We opened up way too fast.
Definitely. Yeah. I mean, even I went to Long Island this weekend, and they're in phase 3. New York City's in phase 2, but they're in phase 3 out there because they didn't get hit as hard. And I went to go to dinner, and I just assumed everything's outside. If you make a reservation, it's outside. I went to this place, and everyone's inside, and no one was wearing a mask. And I just sat there like, I couldn't take my mask off. Yeah. I was like terrified. I was like, I have to leave this place. No, it's just crazy that some of these places have just rolled it. I mean, Georgia is another example. They just right away they reopened, and I don't understand the push for that.
Yeah, and I think to be honest, I think it's political. Like really trying to push everything and get the economy back running. And, I always think that, in times like this, our fight really should be a public health fight. It really shouldn't be a political fight. And as we're hearing, masks are being politicized and all this stuff, it's like, we have to come together as Americans and fight this.
Yeah, I totally agree. It shouldn't be political at all. It should just be, we all live in a community, and we should do our best to protect our community members. Right. And it's as simple as that to me. But yeah, I mean, as far as the economy goes now, with some of these states that are going to have to roll back and go backwards, I mean, that's going to be worse, in my opinion, for the economy.
Exactly. So. And it's, having to, a few states out there probably are going to have to shut down again. And how is that going to be good for small businesses and the economy, when we could have just, done what we would have done in the beginning? And instead of dragging this out, now it's like, who knows when this is going to end? I mean, it's like,
oh my God. I mean, somebody made a comment to me the other day, like, what if we're doing this next year? What if we're here doing the same thing next year, which is possible now?
Definitely possible. With the way things are going, I see this thing going into next year. It's like,
yeah, well, so that's unfortunate. I mean, our hearts are with you. We think about you guys. I'm sorry you guys have to go through this. It's just awful. I worked in the ICU. I'm an RN at a Manhattan ICU.
Okay.
And that's sort of my role with COVID. And I know pharmacy has been so much different. And that's why I wanted to talk to you, because I want to know what you guys are doing and how you're preparing, and how you're keeping yourself safe, and, things like, I mean, you have staff that are going to the floors and delivering medication. And what is that like for you guys?
Yeah. So, the whole issue of PPEs, especially in the hospital, has been a very hot issue. And we have our techs, especially with the proposed medications that are being used, like Actemra, remdesivir. So we get those medications, and then we have to make them in our IV room. So usually our techs are the ones that make them in the IV room, and then we have to deliver them to the floors. So sometimes, a lot of the times, our techs will deliver them. Sometimes I go deliver them if there's no techs around. At the moment, if they're busy doing other stuff, I go deliver them sometimes to the ICU nurses. And as far as PPEs, we have a mask, and sometimes I know one of our pharmacists had bought some face shields for the technicians, but it's like, why do we have to spend money to buy our own PPEs?
Right. Yeah.
But yeah, we have N95 mask as well, because we have a lot of technicians in our ERs as well, and they're doing what is called medication reconciliation. So we have like a team of people, of pharmacists and technicians in our ERs, and it's like COVID city, right, in the ER. So they have to wear their face shields and their masks, especially with the technicians. If a patient comes into the ER and they have to do, medication reconciliation, if that person is a COVID patient, sometimes they have to use their telephone instead of actually going into the room. Or if they do, they have to wear their face shield and their N95 mask. So yeah, it's pretty interesting times, especially in the pharmacy, because now we have to think about the PPEs. Now we have to think about the safety of our technicians and all that, because they deliver the medications to the whole hospital. So those are a lot of things that we're thinking about now during this pandemic.
Definitely. Yeah. And I know because I'm in contact with a lot of RNs within New York City. I mean, I know of RNs who had people in their pharmacy in Manhattan who passed away because of COVID. Because they were, I mean, you guys go to every single floor or you're in contact with someone who does. And like you're saying, you're doing a lot of patient interaction in the emergency room. And I mean, it's really scary. Do you feel like when they're talking about frontline workers, do you feel like they're talking about you? Do you feel like that, or do you feel left out?
Being honest, I think I feel left out, and I think a lot of other pharmacists would feel the same way. I think that the perception of pharmacists really needs to change. Because whenever you think of pharmacists, you think of that guy behind the counter at CVS or Walgreens. I've had conversation with people that they didn't even know that pharmacists work in the hospital. So I think it's a lot about perception. A lot of people don't realize that pharmacists are at the bedside with the physician, with the nurse. You have critical care pharmacists, you have emergency care pharmacists who are at the bedside dealing with code situations. For if a COVID patient goes into a situation where it's a code, pharmacists are right there at the bedside. So I think that especially with the history of pharmacy, we've been trying to get the seat at the table with the rest of the healthcare team, and we've been trying to get provider status and things of that nature. So I do feel sometimes left out as far as when people are talking about frontline workers. They talk about physicians, nurses, respiratory therapists, but not so much pharmacy. But that's the one of the reasons why I do my education, and I do that because I want people to understand pharmacists are a very vital part of the healthcare team. So that's one of the main reasons for my education that I do as well.
Definitely. Yeah. And I mean, I just appreciate pharmacy so much, especially with COVID, because our treatment changes constantly. The medications that we're using or trying changes constantly. And I'm needing education. I call pharmacy. I'm like, you guys got to explain this to me, and like, what dose and what do I do? And they're like, I got you. It's okay. Don't worry. So, I mean, I really appreciate you guys. And I hope that changes a little bit, because you guys are 100% on the front line, and you deserve every bit as praise as everybody else, because you're going through it just as much as the rest of us.
Yeah, thank you so much. I really appreciate that.
Yeah, definitely. If you haven't heard about Anchor, it's the easiest way to make a podcast. Let me explain. First, it's free. There are creation tools that allow you to record and edit your podcast right from your phone or computer. Anchor will distribute your podcast for you so it can be heard on Spotify, Apple Podcasts, and many more platforms. You can make money from your podcast with no minimum listenership. It's everything you need to make a podcast in one place. Download the free Anchor app or go to anchor.fm to get started. I saw you did IG Live with, is it Dr. Williams, also a pharmacist?
Yes.
So you guys were talking about, I mean, a lot of awesome topics you guys covered, health disparities within our healthcare system. And one thing that really stuck out to me was your experience with sickle cell in particular. And I mean, if you feel comfortable sharing that, I guess the first thing I'll say is that I worked in an outpatient clinic, and we ran a sickle cell clinic.
Oh, okay.
And I saw this problem up close. Mm-hmm. I mean, I saw providers who had biased, and I saw patients that were inappropriately treated, inadequately treated.
Right.
And so that it's like a topic that's kind of close to my heart. So I sort of wanted to get you being a healthcare provider on top of your personal experience, I mean, I would just love to hear anything you have to say about that.
Yeah. Sickle cell disease is very a disease that's close to me because my brother has that disease. So, growing up, watching him, suffer with that disease and, having to go to the hospital with our family and watching him, in pain and in agony a lot of the times, it was hard. And I know it was definitely hard on my parents as well, seeing their youngest, go through that. And, sickle cell disease is a very painful and agonizing disease. And, it's one of those type of diseases where, you want to know that you are going to be taken care of when you go to the emergency room, when you go to the hospital. It's something that you want to, know that your provider, cares for you, like he cares for his other patients and other disease states that he takes care of. So, with my brother, having seen things in the healthcare system, not only inpatient, but, in the outpatient pharmacies as well, trying to, get his pain meds and stuff like that. There'll be times where, strictly speaking, in the ER, in the hospital, sometimes my dad or myself would have to advocate for him. And, if he's not getting, pain medicines adequately that he needs or things of that nature, we would have to sometimes advocate with the physicians. And I think, sometimes the nursing too, I've had some interactions just at my job, just the stigma of pain and having a chronic condition. Sometimes I would have to educate nurses that, it is okay for this person to be on this pain med because if they have a chronic condition and they have a condition that's painful that they need to, have taken care of. So I think with the topic of pain and it's just a lot of stigma. And on top of that, the racial, bias and the stereotypes on top of that, especially that sickle cell patients have to deal with in the ER, it's really crazy. And, I was reading some literature about, just sickle cell and racial bias in general. And there's a lot of issues when talking about, beliefs that, providers may have about Black patients that, they have less nerve endings or their skin is thicker. So they're not able to feel, they can tolerate more pain basically. So there's just a lot of different factors when it comes to, treatment of sickle cell patients. And I think that a lot of education needs to happen on the provider side. Because a lot of the times providers, they're not interacting with sickle cell patients, especially during residency. They may not be educated about it enough. So I think that all these things influence, the care that sickle cell patients get, because sickle cell patients in America, majority is African American. So if you go on any sickle cell forum, or if you go on any thread on Twitter, you'll see the main thing is that they don't feel like they're treated with dignity and respect, when they go to the ER. So I think that's one of the biggest things I think that needs to change, especially with sickle cell disease and treatment in the hospital.
Yeah, definitely. Yeah, I totally agree. Patients who attend sickle cell clinic, like the one that I worked at, they tend to live 2 decades longer than patients who don't. But the access to a sickle cell clinic for the average patient is just not there. And a lot of that has to do with, like you're saying, racial bias. It has to do with lack of funding. You look at something like cystic fibrosis, for example, and it's 8 times more funded than sickle cell. And, it's a primarily white, problem. So it just begs the question, when are we going to get over some of this? When are we going to start educating our providers? When are we going to start funding these problems? And I think, it's now or never. I mean, 2020 is kind of our moment to say we're done with this and we want to make a change. I mean, I know that, like you're saying, a lot of the doctors and the nurses don't have experience and aren't taught about sickle cell. And so they get a patient and they have kind of no idea. Versus, I've taken care of cystic fibrosis and those are very sick patients as well. I wish there was an answer there. The problem that I've seen is there's so much information. There's so much information. This is a problem. We've acknowledged that. And I don't see a lot of information on how to solve it.
Yeah, you're definitely right. I mean, especially with the ED situation. I mean, you have patients waiting in the ER for hours. And if you look at the sickle cell guidelines, it says that you need to administer analgesics within at least 30 minutes of triage. So, you have sickle cell patients waiting in the ER for hours. Their triage level needs to be high because we're talking about life and death. I mean, we're talking about a lot of complications that can happen with untreated pain, especially when someone's having a sickle cell crisis. That's very, it's in the name. It's a crisis. It's like
right.
it's an emergency. It needs to be treated. And I'm very encouraged by some doctors out there that I come in contact with and build a network with. They're doing really good as far as changing perceptions in the ER and coming up with protocols to see patients, sickle cell patients faster and making sure providers are aware of the guidelines and making sure they're aware that they need to treat sickle cell patients within a timely manner, as the guidelines state. So I'm encouraged by people out there who are trying to have action. But, like you said, funding is a big issue with sickle cell. It's just, the awareness of sickle cell there needs to be more of it. And, like you said, there just needs to be more education. And, 2020, I mean, everyone is, in their house and just looking back at everything that's happening. It's like everything's on a standstill. It's like, everyone just has to see what's going on, and we can use this time to come together and really, make some changes.
Definitely. Yeah, absolutely. And to your point about sickle cell patients in the emergency room, I mean, I saw there was a statistic from Stat News, which is actually affiliated with like the Boston Globe. And they were saying that patients with sickle cell crisis wait 60% longer than patients with similar or less reported pain. And really, at the end of the day, what can you say to that? There's really nothing else. What is the reason for that? There's no other reason than the bias that surrounds it. So, I just hope that we can start to raise a little bit of awareness and get this solved, because it's not fair to the patients. And like you said, it's a crisis. I mean, this is a life or death situation.
Right. And that's why I'm really passionate as well about, minority representation in healthcare. Because a lot of the biases and a lot of the things actually come from the providers themselves. And if it's coming from the provider, that means it's going to inhibit, the treatment that someone gets, right? So that's why I'm a huge advocate for minority representation and in medicine in general, like pharmacy, whatever you want to get into, inspiring other minorities to see that there are other career options out there. And there are other, fulfilling career options to help, with these disparities as well.
If you have more people who are more representative of the patient population that we're serving, I mean, it's going to be better for everyone. It's going to be a win. Like you're saying, you actually know someone, so you can actually look at this nurse and say, look, actually sickle cell is very painful, and but not everybody has has a personal experience with it. So.
Yeah, that's the thing too, is like a lot of sickle cell patients, a lot of the times they don't have any advocates. They don't have family members with them. They're in the ER all alone and they don't know what to do. A lot of people like my brother, they don't have me or my dad. Like my dad's a pharmacist as well. So they, a lot of times they don't have people who are with them in the ER that can help them. And it's really sad that, that's the case a lot of the times, but that's why, minority representation and all that stuff is really important, especially, with this topic.
Just on a side note, and you can share whatever you want to share or not share, or, how do you feel in general about like this movement 2020? Like, are you hopeful, or are you discouraged that it's taken so long? I mean, how do you feel?
I always call myself like a short-term pessimist, but a long-term, optimist. So the short term, it looks bad right now, but I'm always a hopeful kind of person. I'm always looking to the future and looking towards the long run to see change. And, obviously change is not going to, come overnight, obviously me, with my, children, I want to pass things down to them and they can run the torch as well. So it's like, I try to look, in the long term of things, and I try to, do what I can now to see, the type of change, in the long run. And, past, activists and, they saw the long term goal as well. So it's like, a lot of the changes that we have now are because of what people did, in the past. So, I think I continue to stay hopeful in the long run. Things don't look good now, but I just try to take it day by day, and I am encouraged that things will, get better.
Yeah. Yeah. How do you, just on like to go back to COVID for a second, how are the people in your community? I mean, are they wearing masks? What are they doing?
And you have to wear a mask to get into certain establishments. So the people in my community, yes, are wearing masks now. In South Florida area, now I'm not sure about the north or the other sides, but here where I am and more southern areas, yes, we are wearing masks. So it's encouraging to see when I go out, fellow people in my community wearing masks and stuff like that. But there's still people who obviously are not going to take it seriously. I think I think it's all a hoax. So it's I think one of the biggest things I have against the governor is just like, I wish he would be more of a leader, like step up and say, we're going to do this, we're going to do that. And I think, especially nationally, I think everything is just being left to the states, or you have the mayors, beefing with the governors, like, oh, the mayor says, like, we should just have a unified, leadership as far as COVID and what we're going to do. It's like, I was actually talking to my dad and he brought up a good point. He was like, if someone was going to attack America, the president wouldn't say, okay, Florida, you're off to defend for yourself, or, Oregon, we're going to come together and we're going to fight this common enemy. So, COVID is our common enemy. So we have to come together and fight it.
Of course. Yeah. I mean, we had the same problem, though. I mean, New York City, de Blasio and Cuomo, they hate each other. And then Cuomo and Trump hate each other. And Trump was withholding ventilators from us or something. They were like having an argument. I'm like, oh my God, get it together, you guys. It's crazy.
It's too political. It's like, we should just forget about all that and just come together and beat this. It's like, it's dragging too long. We could have,
we could have been done by now.
Yeah.
Yeah, it's so crazy. Yeah, I mean, the people in New York, we're very lucky. I mean, I guess because the people here saw it up close, they're really compliant with the mask. You really don't see too many people. I mean, once in a while, people are outside. They're a little away from people. They've got it on their chin, like the chin strap or whatever. But I try to give people a pass as long as they're not inside, they're not in a group or whatever. But yeah, I mean, you look at some of these other places like 4th of July, I saw pictures, people are on boats and large groups, and oh my God, it makes me cringe. I deleted some people off of Instagram. I was like, if you're not social distancing, I can't see you.
Yeah, it's crazy. And I don't know if you've heard, I guess in some states, people are having like COVID parties now to see who can get COVID. God. So it's like,
they're so crazy. Yeah. It's absolutely nuts. And I mean, I saw one guy who he went to a party and there was a asymptomatic COVID person who was there and gave it to him. And he wrote like a whole Facebook post about how he shouldn't have been there and that he felt bad. Yeah. And I'm just like, people just think this is a joke until it's actually affecting their own family, and that's the thing I don't get. Like, can't you see what's happening and apply it to your own life and say, oh, I can prevent this. I can prevent my family from getting sick.
Exactly. It's like, you would think people would have common sense to see that this is a deadly virus. But the thing is, a lot of people are stuck on their political mindset. Like, oh, this is just a virus that the liberals want to attack on us. And it's like, it's not like, they're banning, I think there's some countries are even banning Americans from coming.
Yeah, I think we're not allowed in Canada right now and Europe.
Right. Yeah, so it's like they're looking at us as like, you know, what? Didn't you see what happened in Italy? And
yeah, oh my God. I've been trying to learn Italian for like a few years, and I just happened to be following this like Italian language Instagram account. And once in a while I would message the person who runs it. I didn't even know who ran it. I just would message them once in a while. And then they started posting their president talking about COVID. And that was before it hit New York. And I just messaged and said, that this is great because the president speaks very clearly. And so I was this is helpful for me to learn this language. And the person messaged me back and said, oh, you're a nurse. My wife is a nurse in Italy and is currently going through like COVID pandemic. And he just said, brace yourself.
Oh my gosh. Oh my God.
And I think about that message once in a while. I'm like, oh my God, this Italian guy was like telling me my future. Like,
oh my gosh. Yeah, it's crazy. Like how other countries, they saw it. And it's just like, I wish I would have paid attention more, because when it first started, I was like, whatever. But yeah, it's now we're seeing all the effects of it here, especially in Florida. And it's like, and it's crazy. People are coming up with, you know, so many excuses. You know, the conversations I have with people, it's like, you know, it's crazy. Like they're trying to come up with anything and everything to shift the discussion. It's like, you know, look at all these cases and hospitalizations. Oh, but the death rate is down. You know, I tell them, oh, people are dying at my hospital. Oh, it must be just older people. Like it's not younger people. It's like,
right. So what do you do in that situation? Do you try to educate them or do you let it go? What do you do?
So with me, it's hard for me to let things go, especially on social media, because I have a lot of friends who post a lot of misinformation. So it's hard for me not to comment. So a lot of the times I try to educate. I try to, you know, comment and really talk about why, you know, what the person just said is not true. Like, it's not just a disease of older pre-existing conditions. Like, I tell them stories of, you know, personal stories of people at my hospital. Like, we've had young people come in. We had, I think a 38 or 39-year-old go on ECMO. So It's like, it's not just a disease of older pre-existing, you know, conditions, and anyone can really get it. Because with this virus, I mean, we're seeing young people get it. And get severe illness. And then we're seeing some old people not do too well. And then some older people may do well. Some younger people may not do well. So it's like, we don't know what is causing one person to go in such a, you know, critical illness versus someone else who may get mild symptoms or be asymptomatic. So it's like, you don't want to gamble because, you know, you don't know how you're going to react if you get it. So it's like, you have to take the proper precaution.
Exactly. I mean, we saw the same thing. I mean, New York City, we felt like we just didn't know. There was no rhyme or reason. There was nothing that was working. It seemed like some of the things that we were doing were the wrong things. And there was just no protocol for it. And like you're saying, it's so unpredictable. You can't say, oh, this person has this, therefore they're going to have a better outcome. I mean, it just doesn't work that way. This is a new virus and we don't understand it. I've heard of similar things of patients in their 30s getting really sick. I've heard of other healthcare providers taking it home to their family, and maybe they got sick, but their family passed away too.
Yeah, it's crazy. It's so unpredictable. You don't, I mean, I've read stories of young people having to be on dialysis afterwards or anticoagulation afterwards, because a lot of people are not talking about the long-term effects as well. We're just talking about death and hospitalization. But, you know, a lot of people who get out of the ICU, it's a long road to recovery. You know, a lot of people lost a lot of weight, they're wasting, and now they have to recover. And some of them may have to be on anticoagulation for a certain amount of time now because of all the clots that are forming in the body and stuff like that. So, you know, there's a lot of different factors to think about with COVID.
Definitely. Yeah. And exactly like you're saying, they might survive, but they were maybe on a ventilator for 2 weeks and now they have a trach and a peg. I mean, it's just like a nightmare, basically. Yeah, I mean, it's very serious. I'm like you. I had to delete my Facebook because I just couldn't anymore. I mean, I'm originally from Michigan, and I mean, these people were debating about, they were up in arms, angry because the public pool wasn't going to be open this summer. And I just couldn't anymore. I mean, I went on my little nice, thoughtful nurse, thing, and just said like, hey guys, I'm originally from this town. And like, just so you know, I'm working directly with COVID patients, and this is really serious. And it's just better that you stay home and like chill out for 1 year, And I got like 100 replies, like, you're wrong and you're fear mongering and you're scared and you're, a sheep and all of this stuff. And I was like, you know what? I'm just done with the negativity. I just deleted it. I couldn't even deal with it.
Yeah, it's sad. Like, it's people, we can't just come together and use common sense. Like, we have to, people are just seeing things through their political eyes. It's like, you can't see anything any other way. It's like you're held to your, presuppositions about certain things. So it's like, I can tell you, it's a deadly virus. I can tell you, personal stories about what I'm going through. And it's like, whatever.
It doesn't matter, because they heard one travel nurse who wants to sell a book say the opposite. So that's it.
Exactly. Instead of listening to the whole scientific community, you're going to listen to one fringe physician or a nurse or.
Oh my God, it's just crazy. Yeah. I mean, I remember at the beginning, there was 2 doctors who, they were working in a part of California that had like 0 COVID cases at the time. And they were saying, oh, COVID's fake, and in New York City, we're like, what?
Yeah, I think I remember those 2, I think there were like 2 ER docs out in California.
Yeah. Urgent care or something like that. Urgent care, yeah. I mean, I guess this is the question I've been sort of like, kind of grappling with, because I mean, this isn't new, right? We have had this problem with misinformation, and vaccines are a really good example. People anti-vax and all this stuff, right? I mean, to what degree do people have an opinion? And that's allowed and fair, obviously, because you have a right to your opinion. And then where's the line of where it's misinformation and now you're a public health danger?
Right. I mean, that's something I struggle with too, especially with what you brought up, the whole vaccine debate. It's like, that's something I struggle with, because it's like, we have the right, we have our opinions, and we have the right to say what we want to say. But then sometimes it gets, to the point where the stuff you're saying really could be a danger to the public, and especially with this whole hydroxychloroquine situation. I don't know if you heard of the story. There was a story of the dad was a PA and the mother was a nurse, and the daughter, I think, beat cancer and had pre-existing conditions, but the daughter had ended up getting COVID from a church party they had went to. But they took it upon themselves to give, they didn't specify what dose of hydroxychloroquine, but they gave some hydroxychloroquine. Her breathing was getting worse, so they put her on her grandfather's oxygen, and they did not want to go to the hospital. Eventually, they went to the hospital, and she got intubated, and she ended up dying. But it's like, there's just so much misinformation out there, and it gets to the point where it's like life and death. Like, what you're saying could kill someone, So it's like, where do we draw the line? Like, I don't know. That's a hard question.
Yeah, definitely. I think as healthcare providers going forward, after the dust settles, we're gonna have to figure that out to some degree, because I mean, people have a right to their own opinion, but we've just gotten, especially, again, I think it probably goes back to leadership, where facts are just debatable, and if you want to tout, whatever you want to tout in your own home, that's fine. But I mean, I had people on my Instagram page calling me crisis actor, calling me, saying I was a liar, saying I was working for the government. And I mean, people taking time out of their day to so they really believe this is happening,
Right. That's one of the reasons why I think I'm a big advocate of healthcare professionals getting on social media and really combating misinformation. So you have people like Dr. Mike, who has millions of followers, and he's on, Twitter and Instagram and YouTube. And and you have a whole bunch of other, healthcare professionals, actively engaging people on social media and combating misinformation. So I think that I think healthcare professionals are really going to, in my opinion, need to use social media to their advantage. Like they're going to use that to help, combat misinformation. I think that's one way that we can really, help with in regards to this.
Definitely. Yeah. Yeah. Well, I mean, I really appreciate you taking the time to chat today. And I know you're so busy and you're going through COVID pandemic but your insight is really valuable. And that's why I wanted to talk to you today. And also just shout out to pharmacists in general. I mean, you guys are doing awesome. Everybody in pharmacy, like we love you guys and we appreciate you. And I hope you feel the love when everybody talks about frontline workers and COVID workers.
Oh, thank you so much for having me. I really appreciate everything you're doing and the education that you're bringing as far as in the nursing side, because nurses are very important. A lot of the times they don't get the appreciation they deserve as well. So you guys are very, very important, and you guys help out pharmacy a lot too. So we both help each other out.
All right. Well, thank you so much. Stay in touch. Okay.
All right. Yeah, definitely. Thank you so much.
Thank you guys so much for listening. We really appreciate it. If you have any comments or topics you want to submit, please send it to us. We're RNMDPodcast@gmail.com. I think that's going to do it for us today.